y'all.
Hello. Welcome back.
Welcome back, everybody.
Yes.
We're so excited.
Yes. I am
Yes.
Dr. Tisha.
And I'm Dr. Tracy.
And we are
Mahogany Mindset.
Yes.
So-
Again, yes. Thank you for coming back.
Yes. It's been a long journey.
Yes.
To get back here.
Yes. Y'all showed so much support for the first episode. The first two episodes. We had the intro. And then we did the Tourette's. Yes.
And
Uh-huh.
people learned a lot. Actually, people told me they learned a lot about Tourette's.
Yeah, they
didn't
said
know.
it was entertaining. Now, what that means, we don't know.
We don't know what was entertaining, but we're glad we're here.
But it
again.
was, yeah. But they said it was entertaining and informative.
So that's what we're here for.
Yeah, that's what we're here for. And we finna do it again.
Do it again. Do it again.
Okay.
All right.
So remind them about what you said.
Oh, yeah. At the end of the last episode, we were going to talk
episode.
about things that we were coping with,
Mhm.
but we did not understand or we didn't know how to cope with. What did I say?
And things that are out of our control.
Out of control. Yes,
Yeah.
that's what I said. That's
Yeah.
what I said. Yeah, what I said. That's what I said. Yeah. I said how to cope with things you cannot control.
Yes.
And one of the things neither one of us control because we're in our 40s.
Yes.
Women do not tell their age. We're in our
Uh-huh.
40s.
Yes.
And we're going through perimenopause.
Listen.
Both of us at the same time.
I don't know if y'all can hear the fan.
Oh,
We got a fan in the background. And we got fans right here.
Where y'all fans at? Where y'all fans at?
Uh-huh.
Where y'all fans at? Where y'all fans at?
Hey.
Y'all know I know y'all sweating.
Listen, you're going to see this fan.
All the time.
all
You'll
through
film this in this
Okay.
coach.
Hello.
All right. Perimenopause. I guess I'll give a little introduction to what it is.
And we were kind of talking about it when we were thinking about this topic.
Mhm.
We know that it's kind of been beat into the ground.
Man.
And a lot of people have been talking about it.
Yes.
But I feel like that there's more information that needs to be shared.
And we're going to give our little twists and turns to it, too. Our little, put a little sauce on it.
Okay.
I guess we can start with a definition.
Yes.
Perimenopause.
Yes.
And it'll be on the screen also if we're reading too fast. Perimenopause
is
the transitional phase leading up to menopause, which often brings a variety of symptoms due to fluctuating hormone levels. Diagnosing this phase can be challenging, and many symptoms overlap with other conditions.
Yes.
So it makes it very difficult to diagnose
It
perimenopause,
really is.
apparently.
Yeah. And so we're going to talk about some of the signs and symptoms.
Yes.
Some of the diagnostic criteria, as we always do.
Yes. Some of the treatments.
If they're tests.
Yeah, if they're tests.
Yeah. And then treatments. And in the definition, it says some of these symptoms can overlap into other conditions. So that's what we call in psychiatry, well, and just in healthcare in general, differential. And we're going to talk about it. Is it clinical or is it conspiracy?
It's all conspiracy to healthcare because it's like people are like, I don't believe it.
Yeah.
Like, I don't believe
it could be both because it's a little
typical.
bit of,
your brain is your most significant organ in your body because it controls literally everything in your body.
Yeah, absolutely. Even your imagination.
Even your imagination control your symptoms, signs and symptoms of disease states.
Because everything ain't perimenopause, and we're going to talk about it.
Yes, we're going to talk about it.
Yes.
But the facts.
Yeah.
Let's get to the facts.
Okay. The facts. So usually, typically, on average, we're not saying everybody. Yes.
Not everybody.
But usually it happens in your mid to early, like mid 40s.
Yes.
Okay. And then it could last. Now, remember, this is a transition to menopause.
Menopause.
So
I guess we have to define menopause too, because it's like, we're going to define that. Yeah. Okay.
Yeah. And it could last anywhere from months or weeks to years before you even get to the real thing.
To the real deal, holy deal. Which is menopause.
Oh, Lord.
It's
hard being a woman.
Their differential diagnosis of menopause, you have to be without menses for at least consecutively 12 months. Consecutively, no menstrual cycle or no actual bleeding in your cycle.
Yeah.
I guess we could put a cycle up. I don't know if everybody knows what their menstrual cycle looks like. We can put what the cycle look like.
Yeah. And normally it's a 28-day
It's a 28-day cycle.
Some have more or less, and that's kind of how it starts off.
Yes,
You know,
you
when you start to see differences in your cycle, your menses.
Right, because a lot of people start their menstruation earlier than some people. Some started later, so everybody's cycles last between 3 to 10 days, depending who you are. So just depending who you are, and that's between you and your gynecologist, obstetrician, primary care doctor. I don't know who you gonna see. All the things get checked out,
but it's not us.
It's not us. We are not your
doctors.
Physicians,
we're your doctors in spirit. Yes, just bringing some information for your
well-being.
Yes.
So encourage you to get more information.
Okay,
all right. So signs and symptoms.
Yes.
Oh Lord, this
so
it's a lot of
it's a lot of them. It's a lot of them.
Let's believe.
So
we've had like 20 of the 18. I don't know.
We got 20 of the 18.
2018. I don't know. That's a lot. That's all. We have numbers are not having a good time today. We're not having a good time. Numbers. Numbers are not.
That's right. When it counts, you show up. When it counts,
show up.
Show up. Okay. Go ahead. We're gonna focus. So let me. I'll start with the psychological.
I do basic motor. Yeah, this psychological.
Okay,
it's a lot.
So it is a lot, and I am a class. So
okay, what? I personally have felt the anxiety.
Yes.
Panic feeling. Low mood, which could be also described as depression. Loss of motivation, which can also be described as motivation. Depression. Difficulty concentrating. Brain fog.
Brain fog is what they call it.
Yes, you're just like, what am I thinking about? Where did I put my keys? You
walk in the room and like,
what did I come here for? I don't know what I came here for.
What was that?
For something. Difficulty finding word or numbers like me. 18 out of 20, 2018.
Like I said, go to your neurologist because they good at neurology.
We don't know.
That's how I am going to blame it on the estrogen. Fatigue, irritability, mood swings. All of these are the psychological things that can be associated with perimenopause.
Yeah, that's a lot. So the physical, sleep disturbances, breast tenderness, Lord
Jesus,
changing of your hair, nails, and skin, fertility issues. If you're already trying to get pregnant, but you can be trying to get pregnant at 40. Who knows? And you might be having difficulty. Getting babies later. Muscle aches and pain. My knee went out the other day. Y'all, side note. I was just walking. And my neck, my back, my knee was acting up like that. I can't believe it.
Listen, I wake up every morning, my shoulder.
I was like, child,
it's a shake your shoulder off. I can't move it.
It is period knocking on my door. My knee. I ain't never had no knees. I used to be having mag knees back in the day.
Okay.
Don't let them hold you. But now today, period's like, no, ma'am.
Then we got mag.
No, ma'am.
Knees. You know, mag.
End of the knees. No more. The heart palpitations, which already, which can be coincide with anxiety.
Absolutely.
Restless leg, tinnitus, which is ringing in the ears, acne, weight gain,
especially right here.
And
what we got to do is
like it's your friend. Don't worry about it. Osteoporosis or scarsopenia, which is like using bone, a mass. You might feel shorter. No, I feel shorter. I don't 5'4", I might be 5'3" right now. Headaches and migraines.
Oh my God.
Woo! Okay.
So the next part is that sometimes it can affect your intimacy. And there's we're trying to keep it kid friendly in case your kids are watching. So there could be some dryness there. There could be low desires to kick it. UTI,
which is
urinary tract infections.
We can be very specific. everything has a cause and effect because the dry area can cause friction, which can cause bacteria.
You can just have one thing and then it'll lead to all these other things.
It is a cascade of effects, which it can be in general. These sound very uncomfortable, don't they?
Very, very uncomfortable. And the one thing that we
quality of life
didn't talk about too, I think we talked about the hot flashes, but then we talk about the body odor.
Man,
I got 2 different deodorants. I got to switch up and listen. And I washes myself.
Man, what? Okay. I'm very clean. I'm like, my perfume don't smell the same anymore.
Fully clean.
Yes. I feel like I'm pregnant again, but I ain't pregnant.
I know. Okay. Just sweating and I'm not listen. That's why we got fans now.
I notice everything smells bad. I smell every smell.
Listen.
All the things.
The diagnostic criteria. And it's so difficult because even though we may do blood work, and for people who are under the age of 45, a lot of times they want to do more blood work.
Right.
But it could, again, it fluctuates. You know, we talk about our hormones all out of whack, doing all of that. So your labs 1 week can be different than like in a few weeks. So
we showed the chart of how your hormones go up and down throughout your menstrual cycle. Yeah. They're actually doing that all the time. Yes. Every week is different. So it's hard to have a differential diagnosis with the labs. Is it over 45?
So
under 45.
Yeah. Over 45, they really just go by the symptoms.
Yeah, they go by symptoms.
All those symptoms that we just listed, including the time of, you know, how long it's been since you've had your menses.
Yes.
So, but women who are under 45 is usually not typical, so they'll probably want to do some blood work, check your hormones, like your the follicle stimulating hormone, estrogen, your estrogen, testosterone,
progesterone too.
Yeah, progesterone as well. So all those things. So go to the doctor.
Please go get checked. If you have any inkling about anything going on, if you're not feeling normal, you're normal, whatever your normal is, you should really go get it checked. Because it could be a numerous things going on, a myriad of things going on.
And don't wait till the last minute because people come after they've been suffering, and that's anything, suffering for such a long time,
too long,
and then all of a sudden, like, make me better, real quick.
And I'm like, all the things get you better.
You know, like it's gonna take a little time.
So we talked about differential things that could look like what perimenopause look like. So I'm gonna let you talk about the psych. Things that they can look like.
Yeah. So we already kind of talked about that a little bit. When we talked about the low mood, we talked about sometimes with the irritability, crying spells, low energy. A lot of that is depression.
Yeah.
We talked about anxiety and the heart palpitations that come with that.
Yes.
The mood swings could be some undiagnosed bipolar. It could also be some unresolved trauma. You know,
or mental.
Absolutely. Post-traumatic stress disorder.
Yes.
ADHD. We talked about the brain fog.
Yes.
The difficulty.
Is that true? People get diagnosed with ADHD later in life.
They can. They very well. Adult onset ADHD.
Right. Because a lot of people attribute ADHD to childhood, but it could be a diagnosis when you're an adult.
Yeah. And the opposite is true. You see a lot of children that are diagnosed with ADHD, and then when they grow up, it's actually bipolar.
Right.
And so the brain is something else. It's
interesting. It's an interesting organ. It does all things.
Some of those symptoms that could also be what we call premenstrual dysphoric disorder, where you have a lot of PMS symptoms attributed to that.
Angry,
irritability, anger, rage. There's this lady that I love to talk about I don't care. We do not care. I love her. I'm gonna put her on here.
So I started this club called a We Do Not Care Club. And this is for anybody going through perimenopause and menopause. What I did was compile a list of all the stuff that we don't care about no more. Okay? We don't care about bras no more because bras suffocate us. We don't need that no more. We don't care if we look pregnant and we're really not pregnant. We don't care about matching clothes and wearing PJs all day. Clothes is clothes. That's it. That's the standard. We don't care about being on time for nothing. Baby, be happy that I showed up because I don't even want to be here. I don't care about unpainted big toenails and wearing flip-flops with them. Listen, that's a luxury to be able to paint your toenails. Toenails is toenails. Just I'm going to wear my flip-flops and that's that.
Yes, we do not care. So, yes, I probably don't care. I'm sorry, man. I know. So sorry for you.
Leading into that, you know, we talked about the dryness, the low desire to be intimate. It's may not always be perimenopause. It could just be y'all got some relationship stuff going on. Okay, he or she just may not be that into you anymore.
Right, she's not into you. This is a book, isn't it? A movie? I don't know, but either way, we need to get down to the get down. What's going on? You may need, like we said before in other videos, therapy is a godsend. It can cause you to differentiate your diagnosis, and a lot of times if you figure out what's going on in your brain, consciously and subconsciously, because some things going on. But like, perimenopause is a physical thing that's happening to a lot of women because it is a actual hormone shift. Differential medical part. It can be like low iron, which I suffer from all this stuff. I can just not more out. Okay, whatever. Low iron, abnormal thyroid, diabetes, which is sugar. People call it sugar sometimes. Blood sugar. And the blood sugar. Pancreas is not acting right. Heart disease. Ooh, that is a big one because
we leaving here.
Yes, we are leaving here too much because we're not paying attention to our cholesterol. Yes, it could be because when your estrogen goes low, it can cause these diseases too. Because estrogen is a protective hormone. We can get into that. Actually protects your heart. So when you get lower estrogen, it can cause other problems to elevate in your system. Okay. Also, some medical things can be STDs, can be misdiagnosed as perimenopause, side effects of some medication. Yeah. Medication has so many side effects. Lord Jesus. Yeah. Make sure you talk to your pharmacist. Please. Every time you start a new medication and you have something that's not normal to you happening, it may be a side effect or it could be something else.
So if they say, do you want to talk to your pharmacist? Yeah.
Growth in masses in different areas of the body, which are like malignant or benign, could be cancerous or non-cancerous. But anytime a growth happening, it can cause, because a lot of Black women suffer from fibroids, which can cause some of the symptoms of perimenopause, like the abdominal pain, the bloating, the mood changes. A lot of that stuff can be attributed to fibroids. Absolutely. Bleeding differences, changing in your menstrual cycle can be caused by fibroids also. So absolutely, you need to get that diagnosed separate too. Obesity can be, and also being underweight can cause changes to your menstrual cycle also. Yeah. So either way, like anything excessive and causes a change of equilibrium in your body can cause you to feel different than what you would normally feel. So like anytime. And also the way what you eat, what you don't eat. Yeah. So not non-balanced diet or too much of anything is not good. Apparently. Absolutely. Apparently. Who knew?
Poor sleep hygiene too. People people underestimate the power of sleep.
Man, what? I love sleep, actually. I can go sleep right now. Right now. The pillow with me is best friends, baby.
Listen. And if you have a hard time sleeping, you have some issues, go get a sleep study. It's not that bad.
I love my CPAP bed.
Yeah. I love my sleep. My CPAP machine.
We sound very old. Okay. We all right. Don't worry about it.
Young in spirit.
Yes. Don't worry about it. That was a lot of information. We're going to list it on the screen. Yes. Because all this information, we're trying to get it to you in concise manner, but it's a lot of information. Yeah. We're going to list also the references at the end of this too, of where we got all this information from. Because child, it's a lot.
It's a lot.
We went to school for this, and I feel like
hanging in there.
It's a lot of information. Yeah. So after we figure out what's going on with us, we were like, okay, y'all are in perimenopause. Yes. What can we do to fix it?
Yeah. So on my end, okay, so there's medications that you can take. Some medications like antidepressants, SSRIs, SNRIs, there's specific classes of antidepressants can help with hot flashes, can also help, again, just with these specific signs and symptoms that you have, like the depression, things like that. Even though sometimes you just can't treat the menopause, you can treat some of the symptoms that occur.
Yeah, because like it's not a, I guess it's not, it is treatable, but it's not treatable because you're not depleted of all your hormones. It's kind of going towards that way. So you're suffering.
They're all out of whack.
They may go back, they may come back. You may go months without a menstrual cycle, then it pops up again, and then you got to start the countdown again. So you just, it's a lot to deal with. It's a lot to deal with. And then also, your doctor could give you estrogen or progesterone. If they check your levels. All this is under a care of your primary physician or your gynecologist, obstetrician.
Not your friends or your grandmama.
No, girl, I tried this right here. They help for me. Like, no, it needs to be like, girl,
and stop taking each other's medication. Go get your own.
Girl, I saw this on Amazon. They said it worked. No,
we don't talk about that too.
Absolutely not.
We don't talk about that.
Go get checked. Absolutely not.
And even if you don't have insurance, there's the health department. You could go to. A lot of places have like free health clinics. You have to
proactive.
You have to be proactive, and you got to look out for yourself and advocate for yourself, because you're sitting at home complaining and it ain't getting nothing done.
Right. And it's not in your head. Don't let anybody tell you that. Don't be like, girl, it's all in your head. No. Also, lifestyle. Lifestyle. Okay.
Lifestyle, and we can kind of put all of this together. We talked about sleep. Watch your screen time. Make sure that you're getting plenty of sleep. Eat right. Exercise. Do some yoga, cardio, reduction, just whatever you're physically able to do. Again, under the guidance of a med provider.
Right. Limiting your caffeine, alcohol, and spicy food, all the good things.
Spicy food. As you get older, you can't do what you used to do. I used to do.
You gotta put it up.
I can't do no more.
I can't do it anymore.
I
live the little alcohol ain't ever hurt nobody. I know. Hey.
So you did talk about Amazon. You talked about some of the things that people may suggest, but sometimes those supplements can interact with some of the other medications that you take.
Majority of the time,
yes. Talk to your pharmacist and your doctor.
I am a pharmacist. Don't ask me questions in the comments. I have to do a whole med review for you. It's easier to have all your medications filled at one pharmacy, so your pharmacist can go through your list of medications and definitely tell you if something interacts. If you pharmacy hop, it's very hard to tell you if something's going to interact with something else.
Absolutely.
And you take supplements also.
And we don't know what else, the providers don't know what else you're taking.
We do not know.
Please just, kind of keep it simple.
Keep it simple.
KISS.
You know what the last S and KISS stands for. But a lot of the supplements over the counter, we don't even know what's in it. They're not FDA regulated. So it could say in list of ingredients, we don't know how much of what is in anything over the counter that is not FDA regulated. So just be careful if you're choosing to self-treat, which I
don't be sorry. Be careful.
Yes, do not self-treat, please, man. We went to almost 12 years of school to learn. Listen. Google knows a lot, but not everything.
Yes,
your body,
absolutely.
Everybody's an individual. Your body is very different from somebody else's body. So what worked for somebody else probably won't work for you 99% of the times.
And speaking of individual, it's coming. We're going to do consultation.
Yeah, one day.
Friday ones, we're going to do it. We're going to do it.
Because this perimenopause kicking my gotta get it together. Okay.
I think we talked about all this.
We did.
Get your bone density testing.
Cholesterol, blood pressure.
Get all of that. And even with exercise, a lot of times if you do strength training, that helps with the bone, your bone health too. So that helps.
Manage your weight.
So conspiracies.
What they say? What they had said?
You talked about, like, some people think, like I said, you go to the doctor. Everything ain't perimenopause. You just like, I stubbed my toe. I got perimenopause.
Right. I'm like 40, so I'm going through perimenopause. That is not.
No, you don't know that. You don't know that.
No, we don't know that.
But a lot of people think, other people who don't go through it is like they think it's all in your head, but it's not. It's a real thing.
It is a real thing.
It is absolutely
a hormone change.
Yes.
Happens in majority of all women. I cannot say all. Nothing is all. Nothing is no absolutes. So most women having hormone change.
Yes. And we talk about medical neglect, even in especially the African American community. But a lot of times we're told to just like suck it up. It's not that bad, and they really don't actually try to get to the bottom of it. And from what I also read is a lot of times they don't even teach a lot of that in medical schools or nurse practitioner school, wherever you go.
Right. A lot of genetics testing is like new. It's a new thing, and a lot of stuff is genetically diagnosed now because. If your mom, a good source is your family history.
Yeah, absolutely.
Family history is a good source of information.
That's part of the it's part of the
diagnosis.
Initial consult. It should be anyway. Like what happened with the other women in your family.
Your grandmother. If your grandmother had heart disease early, 9 times out of 10, it may be you too. If they had early menopause, you may have early menopause. Like so, getting family history, fibroids is very crucial in understanding perimenopause and menopause also. But the all in the head thing, a lot of African American women or Black women are pushed aside about a lot of symptoms, including pain or anything that maybe that can't have a different like an actual lab, because a lot of medical diagnoses don't have labs.
Right, that's true.
It's like based on the practitioners. I guess expertise
and ruling out everything else that it could be. Yeah.
So be your own advocate.
Yes.
If you do not feel right, you should keep advocating about what is going on with my body. You are control of your body. So control the controllables.
Yeah.
Control. Hey. Do what you want to do. Control. I'm doing the right thing. I got to control this. Lord, what to do this concept?
I know this is a lot of information.
Is.
Like she said, we're going to put it on the screen. We're going to give you the resources, everything that we looked at. So we're very excited to give this information to you as we keep fanning for our life.
Man, what? Because we might be in our 30s now. The timeline, like we said, did you say about the timeline? It can be different, the timeline. People say, we think it's supposed to be 50, it's supposed to start.
Yeah, like people, so it could be as early as your 30s.
Yes.
Yeah.
Yeah. It could,
so you
Lord.
You never know. You never know. You never know.
Y'all.
Listen, thank you again.
Thank you.
Like, follow, share, subscribe,
notification button,
whatever you got to do to get us out there. Okay. And listen, go to Spotify too. We on Spotify.
Yeah, you can listen to us laughing and on your way to work. What?
Yeah.
Brighten your day.
And if you're on I-24, you got plenty of time.
Man, what?
To listen to
we're
us.
In Nashville.
Okay?
I can't tell you where.
We're in Tennessee. Okay. Well, thank you guys so much. We love you. Thank you for your support. Love you. Bye.
Love you. Bye.
Bye.